Hello, everybody. Today I'll be presenting to you the honesty dilemma, or the topic describing the difference between choosing lies or the truth. So, what is all that about? We're going to go around the structure describing the difference between honesty and benevolent deception, a brief overview of Kant's philosophy, who are the opposing professionals of his philosophy, what's the importance of honesty in a working place, the honesty benevolence matrix, my personal opinion, and finishing off with bibliography. So, what's the difference between honesty and benevolence? Honesty, as being the truthful individual in society, is like giving off a discomforting or negative information in the short term, which is with the sole purpose of ending with long term benefits or serving a broader goal for the person opposite to us. Benevolent deception, on the other hand, is deviation from the truth while being kind-hearted or with good intentions towards the other person, which starts with comforting short-term effects, protect the feelings of the other person, but can end. There is a chance to end with unwanted consequences of confusion on or misguidance in the long term, which there is a chance, but still not for sure, since there is still with a good intention. So, what's Immanuel Kant's philosophy and the categorical imperative? His philosophy is all around the intention of being good, no matter what are the consequences. You must always treat people as means to an end, but never as mere means. Using people as mere means is like having pact with them, but you're breaking the pact by doing what is best for your desire and not completing what's also good for the other person. To his philosophy, honesty is best policy, and you must always treat humans as an end and never as a mere means. So, what is the opposition of his philosophy? There is Ingo Zidler, who is a professor in personality and social behavior from the University of Copenhagen, whose main interests are educational psychology and personality psychology. His research is in the cases of counterproductive working behavior, dishonesty, and personality assessment. In his case, examining the two models of personalities, the first one is the Big Five, through which human behavior can be analyzed through five core dimensions, being openness to experience, conscientiousness, extraversion, agreeableness, and neuroticism, with agreeableness being the main factor because human mentality and behavior can vary from agreeable to disagreeable. With agreeable meaning cooperative when speaking to other people, you get the best from both sides, or being disagreeable, being non-cooperative and trying to get only the best result for yourself and not really caring for the opposing party. There is also the other model of personalities, which is the hexacle, which it contains all the five core dimensions from the first one, but there is one more, which is the honesty humility factor, which is cooperating with others even when you might get exploited, in which case you have this kind of retaliation. Meaning, if you're communicating with another person with the best of intention to create a deal, like in a business case, you can get on the bad end of the situation and you cannot get what you want. Meaning that something that the opposing party is doing is not trustworthy, and you can turn from honesty to basically the other side and try to put in a few lies or try to turn the tables to your best end to get what you want. So we have to also see what is the importance of honesty in the professional setting. We're going to use the case of doctor treating his patient. There is always the consequence to the health procedure, as the doctor always has to be very delicate while giving his expertise to the patient. He must not create any kind of deviation or harm to the mentality of the patient, as for not to hinder his procedure to treating the patient. He must also respect the patient's beliefs. He is must be aware not to misguide or to confuse the patient, as to show him that if he is uh, okay, he must be happy about his health situation, or if there is something that must be done, the patient must be ready to cooperate. There is also the devotion to the job, where the doctor, as a health professional, has a duty to follow a protocol to be as truthful and honest as possible, which is very pretty much approved from Kant's point of view and from his philosophy. But there is also some other position where Emma Levine comes to the chase. Professor of behavioral science at Chicago Booth University, she has degrees of philosophy, psychology, and politics. Her main interests are in the psychology of altruism, trust, and ethical dilemmas. Her research has been featured in top psychology, management, and marketing journals, and her case is this of the honesty benevolence matrix. So, what is that? There is lows and highs of benevolence and honesty, which can be used in this specific case of the doctor treating his patient. If we use low honesty and low benevolence, the doctor is basically using an avoidance strategy or missing of giving his professional expertise to the patient, meaning this is the worst outcome of not treating at all or giving his perception for the treatment of the patient. There is also another part where you can choose in between low and high, which is this very dead center of compromising strategy or dodging or deflecting, which is once again trying to treat the patient, but not also giving your best expertise, meaning that you're just going to say the same thing as the patient, but you're not going to help him in any direction whatsoever. There is also high honesty and low benevolence, which is basically brutal honesty or giving the harsh truth to the patient, which can hurt his feelings and hinder the procedure of the doctor trying to treat him. There is the other trade-off strategy, which is high benevolence or low honesty, which is false hopes or encouragement for the patient from the doctor's perspective. Giving false hopes to the patient is overall going to uh, make him happy for his situation, but in the long term can end very badly as of giving him some misconception, making him confused or feel misguided as of not having the right prescription for treatment. Then there is the best case of high honesty and high benevolence for Emma Levine, which is integrative strategy or benevolent honesty, which is giving the truth to the patient, but the truth itself is hidden within the good emotions of the doctor to trying treat the patient. Meaning, as in the case, the doctor is giving his expertise, but he's not trying to use harsh words as to hurt the feelings of the patient, but he's being kind-hearted and well-mannered as to help the patient be stable and carry out a good treatment procedure. So, what's my personal opinion? There is more than just being direct. We cannot always give the harsh truth. There is some lie that we can throw in. Of course, if it's for a friend, we can lie for giving this kind of encouragement, which can always end good, not always, but we can still try. In a professional setting, we must consider the other person's feelings. We must be truthful, but we can always use a trick or two to help out ourselves and make a good ending as a whole. Future events must be taken into account. As always, we must look into the future of what we are exactly saying, but we can also, of course, deviate a little bit from that as to create another perspective. After all, we're all humans, and we cannot always really have the right of saying every truth, and there is always going to be one lie or two, which is basically life. So, yes, there cannot always be a situation where we're the most honest person on earth, and we can use some tricks in life to make the best of it. So here is my bibliography if you're interested. and thank you for your